Metabolic syndrome, what you need to know. Have you ever heard of metabolic syndrome? It's not just a fancy medical term, it's a serious condition that affects millions of people worldwide. And the worst part? Many of us may have it and not even know it. But don't worry, in this video, we're going to demystify metabolic syndrome and break it down into easy-to-understand terms. We'll explore the causes and effects of this condition on your health and discuss the various risk factors associated with it. And the best part? We'll give you practical tips on how to reduce your chances of developing metabolic syndrome through lifestyle changes and proper management. Trust me, this is one video you won't want to miss. So, grab a seat and let's get started on our journey to a healthier, happier you. Before we start, do hit the like and subscribe button. Are you aware of the hidden risk factors that could lead to a serious health condition? Metabolic syndrome is a growing concern worldwide, and it's not just about obesity or high cholesterol levels. In fact, there are several lifestyle and genetic factors that can increase your risk of developing this condition, including poor diet, lack of exercise, and family history of metabolic disorders. By understanding these risk factors, you can take control of your health and make the necessary lifestyle changes to prevent or manage metabolic syndrome. Diagnosis of metabolic syndrome. Metabolic syndrome is diagnosed using the Adult Treatment Panel 3, ATP3, criteria. According to these guidelines, an individual is diagnosed with metabolic syndrome if they have at least 3 of the following 5 risk factors. Waist circumference. The threshold for waist circumference is different for males and females. In males, a waist circumference of 40 inches, 102 centimeters, or more is considered a risk factor, while in females, a waist circumference of 35 inches, 88 centimeters, or more is considered a risk factor. Blood pressure. A blood pressure of 130/85 of a millimeter Hg or higher is considered a risk factor. Fasting blood glucose. A fasting blood glucose level of 100 mg per deciliter or higher is considered a risk factor. Triglyceride levels. A triglyceride level of 150 mg per deciliter or higher is considered a risk factor. High-density lipoprotein, HDL, cholesterol. The threshold for HDL cholesterol is different for males and females. In males, an HDL cholesterol level of less than 40 mg per deciliter is considered a risk factor, while in females, an HDL cholesterol level of less than 50 mg per deciliter is considered a risk factor. It's important to note that the ATP3 criteria are not the only set of diagnostic criteria for metabolic syndrome, but they are widely used in clinical practice. Management of metabolic syndrome. When it comes to pharmacological management options for metabolic syndrome, healthcare providers may prescribe medications to manage blood pressure and cholesterol levels. For example, angiotensin-converting enzyme (ACE) inhibitors, angiotensin receptor blockers (ARBs), diuretics, and calcium channel blockers can be used to manage high blood pressure. Statins, fibrates, and bile acid sequestrants may be prescribed to help lower cholesterol levels. However, non-pharmacological management options are also crucial in managing metabolic syndrome. Lifestyle changes such as regular exercise, stress management, and weight loss can significantly improve the symptoms of metabolic syndrome. Studies have shown that even modest weight loss can help reduce insulin resistance and lower blood pressure and cholesterol levels. It is important to note that regular monitoring and follow-up care are essential in the management of metabolic syndrome. This involves monitoring blood pressure, cholesterol levels, and blood sugar levels, as well as assessing progress in weight loss and lifestyle changes. With appropriate management, metabolic syndrome can be controlled, and the risk of developing serious health conditions like diabetes, heart disease, and stroke can be significantly reduced. Food to avoid to prevent metabolic syndrome. Diet plays a crucial role in the prevention and management of metabolic syndrome. To avoid the development of metabolic syndrome, it is important to avoid certain foods that can contribute to the development of these conditions. Processed foods are one of the main culprits that can lead to metabolic syndrome. These foods are often high in added sugars, unhealthy fats, and salt. Processed foods include fast foods, frozen meals, baked goods, and packaged snacks. Instead, it is recommended to consume whole foods that are minimally processed such as fruits, vegetables, lean protein sources, whole grains, and healthy fats. High sugar foods should also be avoided as they can lead to elevated blood sugar levels and contribute to insulin resistance. These foods include sugary drinks such as soda and energy drinks, candy, and baked goods. It is important to read food labels carefully to identify added sugars in packaged foods. In contrast, a healthy diet can help manage metabolic syndrome by reducing blood pressure, blood sugar, and cholesterol levels. A healthy diet includes a variety of fruits and vegetables, whole grains, lean protein sources such as fish and poultry, and healthy fats such as olive oil, nuts, and avocados. A healthy diet rich in whole foods can help manage metabolic syndrome by reducing the risk factors associated with this condition. Conclusion. In summary, early detection of metabolic syndrome is crucial to prevent its progression and associated health risks. Proper management involves a combination of pharmacological and non-pharmacological interventions, including regular exercise, stress management, and weight loss. A healthy diet, including the avoidance of processed and high-sugar foods, is also essential. Regular monitoring and follow-up care are necessary to ensure effective management of metabolic syndrome. By making these changes and taking control of their health, individuals can reduce the risk of developing serious health complications associated with metabolic syndrome. Thanks for watching.